Kristen, there's also something of an update from the president on his health. He revealed to reporters that he's recently got an MRI. What are we learning about it?
Yeah, I mean, it was this moment on Air Force One where we had asked a number of times, including the last press briefing from the press secretary, what kind of advanced imaging President Trump had gotten during his last trip to Walter Reed. Just a reminder, that had come out as part of the release. And the press secretary said she didn't know. Well, President Trump was directly asked on this plane whether or not he got an MRI, and he said yes, he did.
So now a routine checkup includes an MRI that the press wasn't told about. That's interesting. And now for our 13,000th edition of the game, imagine this was Biden.
Most of us do not get an MRI as part of a normal physical. Aren't they typically used to detect things like strokes and aneurysms and tumors? I mean, do you have any clues as to why the president would have gotten an MRI?
You're right, Sarah. It's not part of a routine screening examination. There's been really a lack of candor coming from the White House about this. When they announced that the president would visit Walter Reed at the beginning of this month, they initially said it was for his annual checkup. But when they were reminded that that's not due until April, they said, okay, it's for a routine semi-annual checkup. But just physical exams are done in the White House. The White House has a prodigious testing capacity. And the president and vice president go to Walter Reed for testing that is not available at the White House, something like a CT or, as we now hear, an MRI. The big question is, what prompted his MRI?
Donald Trump recently told reporters aboard Air Force One en route to Tokyo that, quote, I got an MRI. It was perfect.
Walter Reed mentioned advanced medical imaging. Did you get an MRI? Can you tell us what?
I did. I got an MRI. It was perfect. Yeah. I mean, I gave you the full results. We had an MRI, and in the machine, the whole thing, yeah. And it was perfect. Yeah.
Did you say what in particular they were?
You could ask the doctors. In fact, we have doctors traveling with us, but I think they gave you a very conclusive. Nobody has ever given you reports like I gave you. And if I didn't think it was going to be good either.
The White House labeled it as a, quote, routine yearly checkup, though his last physical was just 6 months ago. And here's the problem, right? MRIs are not routine. They're done when there's a specific concern, not just because you want a picture of your insides for the fridge. Medical experts told NBC News that this kind of scan is typically ordered when a patient either reports pain, swelling, or visible bruising, not during a healthy president's annual exam, as we've been told. So if it's routine, why conceal it? And why the secrecy until reporters started asking about it?
And now, why won't they tell us exactly what was tested, why the testing was performed, and the results? I think without that, then there's really no trust.
I do want to ask you whether it could have anything to do with the bruising that we saw in photos of the president's hands, or the swelling of his legs, of his sort of ankles. Could an MRI be used to try to detect what is causing that?
Perhaps not, for the bruising itself. Typically, when I see bruising on the back of someone's hands, and I see this every week in clinic, it's typically in somebody who's on a blood thinner, but we've not been told that the president is taking a blood thinner. But you take a blood thinner for a variety of underlying conditions, things like atrial fibrillation, pulmonary embolism, deep vein thrombosis. None of that has been disclosed to the public. And for some of those conditions, one might end up getting an MRI. So I think the problem is that once there's lack of candor for one part of a patient's evaluation, it then becomes difficult to sort of backtrack and tell us the truth about a current issue. I think the best step now would be simply for the White House, explain why you tested the president. The president said the results were great, and that's fabulous. And that'll be very reassuring for the public. But when you hide things from the public, people will typically imagine conditions that are much worse than the truth. So the truth is the truth. Just tell the public what's going on with the president.
Good advice there, Dr. Jonathan Reiner. Thank you so much.
And let's talk precedent here for a moment, right? Because we've seen this movie before when Joe Biden coughed during a speech or, say, stumbled up or down Air Force One, cable panels turned into live neurology consults, especially those on Fox News. Trump, meanwhile, quietly undergoes an MRI at Walter Reed and calls it routine. But if you flick over to the Murdoch Manipulation Network, well, it's wall-to-wall Mamdani.
Proved that the Democrat Party's main constituency are made up of Hamas terrorists, illegal aliens, and violent criminals. That is who the Democrat Party is catering to, not the Trump administration and not the White House and not the Republican Party, who is standing up for law-abiding Americans, not just across the country, but around the world. And that,
Which prompts a question. Imagine if Biden had done this.
Sent in the National Guard into Texas and just said, you know what? A lot of problems in Dallas. You know, a lot of crime there. And I don't care what Governor Abbott says. I'm going to kind of take over law enforcement because I think things are out of control. It is mind-boggling to me how Fox News would have responded.
Yeah.
I mean, there were times where I remember there was a moment, I don't remember what year this was, where the military just had regular exercises in Texas, out of one of the bases, Fort Hood, and Ted Cruz and a number of other folks were out there lending credence to the fact that I was preparing for, the whole black helicopter, one world government. I was about to take over Texas. And this is like a sitting U.S. senator.
Yeah.
It's like kind of retweeting about what's going on with these exercises.
Secret ops.
I didn't even have any. I didn't monitor military exercises because you know what? That was the Pentagon's job. That was the Secretary of Defense and the Joint Chiefs of Staff and the COCOMs. That was their job to prepare and focus on military readiness, and then they'd report to me. The point is that we have blown through, just in the last 6 months, a whole range of not simply assumptions, but rules and laws and practices that were put in place to.
Same networks calling this business as usual would have called for an immediate wellness tribunal. And the thing is, it's just about transparency, right? If MRIs are now routine, then the standard for disclosure just changed. And if they're not routine, then the public has every right to wonder what the scan was looking for.
They have Jasmine Crockett, a low IQ person. They have AOC's low IQ. You give her an IQ test, have her pass like the exams that I decided to take when I was at Walter Reed. Those are very hard, they're really aptitude tests, I guess, in a certain way, but they're cognitive tests. Let AOC go against Trump. Let Jasmine go against Trump. I don't think Jasmine, the first couple of questions are easy. A tiger, an elephant, a giraffe, When you get up to about 5 or 6, and then when you get up to 10 and 20 and 25, they couldn't come close to answering any of those questions.
Currently humoring talks of yet another term, because that's not scary and authoritarian at all, is it?
Very good people.
They are good people.
For 2028, they're very good people.
Oh, we have great people. I don't have to get into that, but we have one of them standing right here. We have JD, obviously. The vice president is great. The Marco's great. I think, I'm not sure if anybody would run against those two. I think if they ever formed a group, it would be unstoppable. I really do. I believe that. I would love to do it. I have my best numbers ever. It's very terrible. I have my best numbers. If you read it, am I not ruling it out? You'll have to tell me. All I can tell you is that we have a great group of people, which they don't. They have Jasmine Crockett, a low IQ person. They have AOC's low IQ. You give her an IQ test, have her pass like the exams that I decided to take when I was at Walter Reed. Those are very hard, they're really aptitude tests, I guess, in a certain way, but they're cognitive tests. Let AOC go against Trump. Let Jasmine go against Trump. I don't think Jasmine, the first couple of questions are easy. A tiger, an elephant, a giraffe, When you get up to about 5 or 6, and then when you get up to 10 and 20 and 25, They couldn't come close to answering any of those questions.
And I get it, right? With the amount of lies and disinformation that this administration peddles, complacency is bound to happen. But just because the administration claims it's routine, it doesn't mean that it is. Their version of routine means just don't ask questions, which journalists need to do.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.